During this presentation, specialists from the University of Wisconsin-Madison Division of Extension and the Wisconsin Department of Agriculture, Trade, and Consumer Protection discuss biosecurity practices and concepts for livestock when there is a foreign animal disease outbreak in your area or on your farm. If you have watched our daily farm biosecurity video, then you should understand what routine biosecurity on the farm means and the importance of it. When we enter times of increased risk for bringing diseases onto our farms, like during a foreign animal disease or FAD or FAD outbreak, we need to shift from our everyday basic biosecurity practices to enhanced or heightened biosecurity. As we discussed in the basic biosecurity presentation, having routine biosecurity practices in place and using them every day better positions us to handle the uncommon diseases, like FADs. So if you have not already, please review the Daily Farm Biosecurity video. Having a FAD in your neighborhood will prompt you to review your current biosecurity practices and add additional measures to prevent disease access and protect your farm against the current threat. The specific measures taken will differ with each disease and each farm. This video walks you through some of the initial steps that will occur if a disease breaks in your area or on your farm.
There are many steps you can take before the start of an outbreak. Sign up to receive news alerts from DATCAP, which will inform you about disease outbreaks and the steps you can take to reduce risk to your operation. Register your premises and ensure your email and phone number are kept up to date. We use this information to reach out to you when an outbreak occurs in your area. Premises registration is required by Wisconsin state statute. At least annually, talk with your veterinarian to identify risks, gaps, and shortfalls to your operations biosecurity. Update your biosecurity plan as operations or risks change. Annually or as changes occur, take some time to ensure your family, staff, and visitors all understand the plan and your requirements. If you haven't created a continuity of business plan, otherwise known as a secure food supply plan, do so now. Your veterinarian can help you with this. Review and update it annually or as changes occur in your operation or as risk change occurs. Each of the logos shown on this slide have a website available with resources that can help you get started. Best of all, the plans, resources, and information is all free. You know your animals best. You are with them each and every day. If something doesn't seem right, it probably isn't. If you notice signs or symptoms that your herd or flock may be affected by a foreign animal disease or other disease, it is important that you contact your veterinarian or state animal health official as soon as possible. Contact your veterinarian or the state veterinarian's office at the numbers listed on this slide without delay if you suspect a foreign animal disease. Resources are available on the DATCAP website or through your veterinarian that provide you with more information about foreign animal diseases.
If animals need to be tested for a foreign animal disease at your farm, a USDA or state veterinarian will collect samples from your herd or flock. Testing may also be required in farms surrounding an infected farm, even if the animals do not appear sick. Depending on the disease we are testing for, samples may be tested at the Wisconsin Veterinary Diagnostic Laboratory, or WVDL, for initial testing, followed by confirmatory testing at one of the National Veterinary Services Laboratories, or NVSL. Once a foreign animal disease has been diagnosed on a farm, we establish several zones around the infected premises. The zone that is nearest to the infected farm is called the infected zone. The next zone is the buffer zone, and the third is called the surveillance zone. The distance away from the infected farm for each zone varies by disease, but the approach is similar. In general, other premises within the infected and buffer zones, known as the control area, are placed under quarantine where all movements are restricted and testing animals for the disease may be required. Premises that are within the surveillance zone will receive a questionnaire and may be required to conduct testing to show that their animals are free of disease before the control area can be released.
The reason that farms within the control area are also placed under quarantine is because we know the disease has infected a farm in the area, and we need to minimize the risk of that disease infecting other farms in the surrounding area. Minimizing movements through quarantines and putting biosecurity requirements in place are important steps to reduce the risk of introducing disease into your farm during a disease outbreak. This mapping tool allows individuals to check if an address is located in a control area or surveillance zone. The map is updated when new premises are identified or when restrictions have been lifted for specific areas. Currently, Wisconsin Department of Agriculture, Trade and Consumer Protection uses the mapping tool for highly pathogenic avian influenza outbreaks. Similar mapping tools may be used for other foreign animal disease outbreaks.
If your farm is diagnosed with a FAD, a quarantine will be placed and state or federal staff will be assigned to your farm as a case manager. This person will need to gather information about animal inventory, animal and product movements, and people visiting the farm. This information will be important in determining how the infection may have been introduced to the farm, and it's important for identifying other farms at risk for the disease. Having accurate and quickly accessible records of animal movements and visitor logs is very important for the epidemiological investigations that are conducted with these cases. State or federal staff will assist in paperwork that may need to be completed.
When a foreign animal disease is detected on your premises or close to it, the Wisconsin Department of Agriculture, Trade and Consumer Protection, and the U.S. Department of Agriculture will work with you and others in the local area to immediately contain the outbreak in order to protect animal health. This slide outlines what you can expect in the first days and weeks of an outbreak in your area or on your premises. It is not an all-inclusive list, and some steps may be taken simultaneously or in a different order depending on the situation. A state animal health official will be assigned as a case manager if your premises is infected, and they will guide you through the end of the process.
Remember the line of separation from the basic biosecurity presentation? The line of separation is like a moat around a castle, and the drawbridge like the entry points to help exclude diseases from entering your farm. This is called bioexclusion. You are focused on keeping disease out. When a farm becomes infected with a FAD, we shift our focus. Now we are trying to keep the disease from leaving the infected farm and infecting other farms. This is called biocontainment. The line of separation is just as important in preventing a disease from leaving an infected farm. It helps control movements off the farm and can be used to set up cleaning and disinfecting stations for vehicles and equipment. State and federal officials will help you in establishing and putting measures in place to stop the disease from spreading off of your farm and infecting other farms. Additional personal protective equipment, PPE, and cleaning and disinfecting steps will likely be needed to reduce risks of tracking the disease off the farm. State and federal staff routinely practice using PPE in a simulated FAD environment and can provide training to you and your farm staff. A critical part of biocontainment depends on you abiding by the restrictions in your farm's quarantine. While your farm is under a quarantine, it is important that you follow biosecurity requirements, including limiting traffic to only those authorized to enter and exit the premise. Some of these movements will require a permit to be issued prior to the movement happening. For example, a permit may be required before a garbage disposal company can enter the farm to remove waste containers.
For more information about foreign animal diseases of concern in the United States Department of Agriculture, Animal and Plant Health Inspection Service, or USDA APHIS, has basic information for specific species infected. This can be a helpful resource to learn more about the infection basics, including how it's transmitted and potential risk factors.
When a foreign animal disease is confirmed in Wisconsin, DATCAP will establish a website to provide outbreak information and links to other resources. Additionally, USDA, CDC, Wisconsin DNR, and DHS, and other agencies will provide updates, information, and other resources on their own websites. On this slide, you can see some examples of information that is currently available related to the highly pathogenic avian influenza outbreak in the U.S. Take time to learn about diseases that may be of concern for the animals that you raise. Learn about what signs to watch for, who to call if you suspect a problem, and the steps you can take to protect your farm and your animals. Make sure everyone who works with your animals is given the same information and knows who to call if something doesn't seem right. If you haven't already created a continuity of business plan for your farm, take the time to do so. As mentioned previously, each of the icons shown on this screen have free planning templates and resources available now to help you get started. These plans are a first good step to help you keep foreign animal diseases and regular production illnesses off your farm. Reach out to your veterinarian to get started today.
The first days of a response are equivalent to a sprint, but the response efforts that come later are similar to preparing for a marathon. You need to ensure that you, your family, and your employees make self-care a priority to remain healthy during this time. Take care of yourself, try to eat, get some sleep, and ask for help. Experiencing mental health challenges can be confusing and frightening. If you need someone to talk to about what is happening, experts are available to help. Your case manager or local public health department can provide mental health resource information.